Hello everyone. Today, we're exploring the medication Rybelsus. As always, our goal is to educate, so if you have any health-related questions or concerns, do ensure you contact a medical professional. Description: Rybelsus, whose generic name is semaglutide, is an oral tablet primarily designed to control blood sugar levels in adults with type 2 diabetes mellitus. Unlike insulin, Rybelsus is not for people with type 1 diabetes or for people with diabetic ketoacidosis. It belongs to a class of drugs known as GLP-1 receptor agonists, which mimic the effects of the body's natural incretin hormones, helping to boost insulin production after meals. Additionally, Rybelsus may reduce the risk of major cardiovascular events, such as heart attack, stroke, or death, in adults with type 2 diabetes mellitus who also have heart disease. Warnings: while Rybelsus offers numerous benefits, it also comes with certain warnings. For instance, Rybelsus may increase the risk of tumors in the thyroid, including thyroid cancer. Thus, it's not recommended for those with a family history of medullary thyroid carcinoma, MTC, or those diagnosed with multiple endocrine neoplasia syndrome type 2. Before taking this medicine. Prior to starting Rybelsus, there are several factors that you should discuss with your healthcare provider. Inform your doctor if you have ever had pancreatitis, vision problems caused by diabetes, kidney disease, liver disease, depression, a blood clot, or a stomach disorder. It's also important to share if you are pregnant, planning to become pregnant, or breastfeeding. If you're already using insulin or other diabetes medications, discuss this with your doctor as adjustments might be necessary. Side effects: like all medications, Rybelsus can cause side effects. Some of the most common side effects include stomach problems such as nausea, diarrhea, vomiting, decreased appetite, and stomach pain. It's important to be vigilant and consult your healthcare provider if you notice these or any unusual symptoms. Moreover, there's a risk of low blood sugar when Rybelsus is taken with other diabetes medications. Symptoms of low blood sugar include shaking, sweating, fast heartbeat, and blurred vision. If you experience any of these symptoms, it's essential to take immediate actions to treat it and contact your healthcare provider. Interactions: Rybelsus may interact with other medications, so it's crucial to notify your doctor about any other drugs, supplements, or herbal products you're currently using. Dosage: the right dosage ensures the effectiveness of any medication. Adhere strictly to your doctor's recommendations when taking Rybelsus. Depending on the individual and their needs, the dosage may vary. It's always recommended to take Rybelsus on an empty stomach, when you first wake up, with a sip of plain water only. Wait at least 30 minutes before eating, drinking, or taking other oral medications. Ensure you're taking the correct dose and never modify your dosage without consulting your healthcare provider. Avoid: while on Rybelsus, avoid skipping meals and be consistent about the time you take the medication. It's also advisable to limit alcohol consumption, as it can affect your blood sugar levels. FAQ: a common query regarding Rybelsus is its comparison with injectable semaglutide. While both have the same active ingredient, Rybelsus is taken orally, while the other form is an injectable. The choice between the two would depend on individual preferences and medical advice. Closing: that concludes our discussion on Rybelsus. It's paramount to remember that this information is intended to inform and is not a substitute for professional medical advice. Always reach out to a healthcare provider with any questions or uncertainties. Thank you for joining us.